Hello to all of our local residents and viewers from around the world. As you know, we are presently dealing with the coronavirus pandemic, also known as COVID-19, and it has affected the lives of practically every citizen in our nation. There are some common sense measures that we can take to prevent the spread of the coronavirus, and they are as follows. Wash your hands. Wet your hands and apply soap. Wash the back of the hands and between the fingers for an estimated 20 seconds. If soap and water is not available, use an alcohol-based sanitizer, which contains about 60% alcohol. Get a flu shot. It will not protect against the coronavirus, but it will help protect people from getting the flu. And the flu is what most people are likely to contract and become ill, thus tying up major resources by healthcare providers and hospitals, which at this time are needed to combat the coronavirus. Germ management. Symptoms of coronavirus typically occur within 14 days of infection and can include fever, cough, and shortness of breath. If you must cough or sneeze, do so in a tissue, and discard the tissue in the trash or cough or sneeze into the inside of your elbow. Avoid touching your eyes, nose, and mouth. Keep surfaces in your home clean. Countertops, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tables, TV remote controls, and bedside tables. Keep those clean. Stay at home if you're sick. If you have a fever, cough, or difficulty breathing, seek medical attention, but first call your healthcare provider or hospital before you visit, so that they can make the appropriate arrangements for your visit, to ensure that the best of care can be provided for you while reducing the risk of possible spread to other patients and healthcare providers. Put together a plan. Experts say that it is sensible to have 2 to 4 weeks of food and other household supplies, such as detergents, and there should be a 3-month supply of imported medications on hand. Social distancing. Don't attend concerts, festivals, sporting events, and crowd activities with greater than 10 people. Please remember to check on your elders. This message is brought to you by Wayne Pharmaceuticals and Dr. Wayne's Aspirin. I'm Dr. Wayne. Until next time, be safe.
Free from heartache and pain. I wanna be free. Take an aspirin a day from the doctor, Dr. Wayne. I wanna be free from heartache and pain. I wanna be free. Take an aspirin.
Hello to all of our local viewers and those watching from around the world. I'm Dr. Wayne, and welcome to the Dr. Wayne Health and Wellness Show. Today we will be speaking with Tyrone Walker. Tyrone is a local resident of Cordele, Christian County, and a COVID-19 survivor from Cordele, Georgia. So he's going to share with us some information about his experience with COVID-19. Welcome, Tyrone. Good to have you with us today.
Yes, sir. Thank you. Glad to be here, sir.
So, Tyrone, just first of all, tell us a little bit about yourself, what you do and your work in here in Cordele.
Okay. I worked at the local Captain D's here for numerous years. I am married to Angela Walker. We have 5 kids and 3 grandkids, and I love reading and watching TV, and love spending time with my family.
Good thing. So. Good thing. So you hear a little bit about Tyrone. He's a family man, and very much much a part of this community and well known throughout the community. If you go to Captain D's, go out there, you know you're always going to get good service with a smile on your face, and you're going to make sure you're going to be satisfied. We want to talk a little bit about your experiences with COVID-19. You had a bout with that earlier.
Yes, sir.
Can you share a little bit with us about that? What happened? You developed some signs and symptoms. Tell us about how that began.
My wife had contracted it first. I took her to the hospital a week before that. They sent her home and told her she had a sinus infection, Chris Regional. She didn't get no better within 4 to 5 days. We took her back out there that Monday, that next Monday around, they kept her. They gave her the COVID-19 test, and they told her she had symptoms of the COVID-19. That Tuesday, I checked my temperature. It was 100.1. By that Thursday, it was out of control for me. I went and got my wife that Wednesday. That Thursday, I had to be admitted into the hospital. It was an experience I never experienced before. It was a scary experience. I never had my heart race that fast. It would be like 165 to 170 beats per minute.
That's high.
Yes, sir.
Yeah.
Yes, sir. And when I went in the hospital, they asked me, have I been doing cocaine or any speed drugs for my heart rate to be beating that fast? And I told them I never done drugs. Doctor, I can't think his whole name, but Dr. K was the physician over the ER that day. They stuck me in my neck. They put an IV in my neck, gave me some medicine to slow my heart rate down. They got it down to 145 beats per minute. He told me, he told the nurses that were going to be the working range that they were going to have to work with me on. They gave me some IVs, and I hear a lot of people saying now that the Plaquenil, you shouldn't take it, but that's what they gave me in the hospital. When I guess this was the early stages of the situation. That Thursday, it was real bad for me. That Friday, it was real bad. That Saturday, everything kind of leveled off after that third dose of Plaquenil. That Sunday, my tent was gone. They put me in a regular room. I had no more symptoms. They let me out that Tuesday. When they let me out that Tuesday, I still didn't have an appetite, nor did I have a lot of energy. It was draining. The owner, Captain Dees, he called me, and because all my doctors in Tilton, because I had a bad experience with Chris County about 10 years ago. So I had got all my doctors in Tilton. He had me to call the CEO of Tiff Regional, the guy named Chris, and he was asking me some questions and what they had done. And one of the things that Chris told me was, make sure you get up and move around. So whatever you do, don't stay idle. He said, because it affects your lungs real bad when you just stay idle. Mm-hmm. So I got up and started walking around and doing different things just in the house, just isolating myself. And after that 5th day, he sent me a polyoximeter. Mm-hmm. I think that to check your O2 sat.
Yeah. Yes. Mm-hmm.
Yes, sir. He sent me one of those. I checked it 3-4 times a day. That 5th day, after I got out of the hospital, it stayed up around a 92. That 7th day, the first time I had got it back up to 97.
97. Okay.
Yes, sir. Mm-hmm. Yes, sir.
So from the time that you were hospitalized, what was it, on a Wednesday?
A Thursday.
A Thursday.
Yes, sir.
And you were out of the hospital
that next Tuesday.
Yes, so
sir.
You had a rather fast progression, and you got better pretty fast.
Yes, sir.
Remarkably fast in comparison to some other people that got down sick with it.
Yes, sir. Dr. K came in the room. He said, and he told me, he said, I don't know what happened, but you're one of those special ones that it didn't affect, on a deeper scale like it did a lot of people. He started naming some stuff that some of the people had went through. I won't say that because we're talking about me. Mm-hmm. But I just was grateful that, that I didn't have to go through a lot of that. Yes, I did have some underlying issues before I went in, but it didn't stop me from, getting healed in a hurry neither. Okay. Yes, sir.
So you were never on a ventilator. You
No,
were
sir.
never in intensive care.
Yeah, I
You
went to
intensive care.
Yes, sir.
But you weren't on a ventilator.
No, sir.
Okay, and you're about 4 or 5 days, and you out of the hospital.
Yes, sir. I was in the intensive care that Thursday, that Friday, and that Saturday. That Sunday, Monday, and Tuesday, I was in a regular room.
Okay.
Yes, sir.
How did it affect your wife? Was she hospitalized also?
Now, when I took my wife that first time, they didn't hospitalize. They gave her some for her sinuses. And the next week around, they hospitalized her that Monday night, and I went and got her that Wednesday morning. And they told her to quarantine for 14 more days.
Okay.
Now, with my wife, it was totally different. She never had no underlying issues, nothing never wrong with her. She couldn't even get up and walk to the bathroom without, coming back in sweats and couldn't hardly breathe.
Short of breath. Huh?
Yes, a real short of breath. And it took her probably 6 to 8 weeks just to get back up to a 92.02 set.
Okay.
Yes, sir.
Okay, when she said 92 saturation rate, that means the oxygen concentration in the blood. That's what he's talking about.
Yes, sir.
And but they look for it to be within the high 90s.
Mm-hmm.
So we said 91, 92. That's the lower level, but still acceptable. But doctors look for you to be in the high 90s at that level. And this COVID-19 that affects the respiratory rate, and it reduces the oxygen level, so people get short of breath, short-winded, if you will.
Yes,
so
sir.
that's what he's alluding to when he's talking about the O saturation rate.
Yes, sir.
You talked about, you said she didn't have any underlying issues, and it seems to have affected her a little bit more.
Yes, sir, it did.
A little bit more than yourself, and she's had some lingering effects afterwards. And you had some underlying health issues.
Yes, sir.
Any that you care to discuss?
Oh, yes, sir. I had diabetes and high blood pressure problem.
Okay.
And that's something, I've been trying to keep under control.
Okay.
But I did have those issues before I went, before I caught the COVID-19. Yes, sir.
Did your doctor any mention or say if that may have kind of put you at risk, greater risk for COVID-19 and some of the severe symptoms or some of the symptoms that you had?
No, sir. They didn't. Neither one of my doctors told me that per se. But you hear it now on the news saying, those are the ones that really need to watch out for the situation, the one that have underlying issue. And once again, to me, it was more of they were still at shock because of what I went through and how fast I came out of it with no symptoms. They didn't send me home on no medicine, no nothing.
Okay.
Yes, sir.
We're having a good talk and discussion here today with Tyrone Walker. We're going to take a break, and we'll return with our discussion after this break.
Dr. Wayne's aspirin is a low-dose tablet that promotes heart health while reducing the risk of heart attacks and strokes. Heart disease is the leading cause of deaths of Americans. Recent studies have concluded that a daily low-dose aspirin also reduces the risk of colorectal cancer. Taking low-dose aspirin is not safe for everyone. Only take low-dose aspirin if your doctor recommends it. Try Dr. Wayne's aspirin, coming to a store near you soon.
My name is Evan Edwards. I am the Director of Community Sustainability and Health Initiatives. We just wrapped up one of our health and wellness classes that we have every week, Monday through Friday from 9 a.m. to 11 a.m. It's open to the public at no cost whatsoever. And here we just do functional training, stretching, multiple types of exercises and cardiovascular movements to mimic everyday movements for our senior citizens and anyone actually that needs to come in and get a workout or has had some type of surgery or injury that prevents them from being as mobile as they'd like. We just partnered with Silver Sneakers, which is catered to members of the community that are 65 years and older, with Prime for anyone 18 to 64. We are one, if not the only, privately owned black fitness facilities in the state that offers these programs. We want to get everybody involved. We are are doing many other things here at the MD Whitehead Institute. We do toy drives, we do the food bank that's coming up. We're going to be one of the places that families that are less fortunate can come in and weekly pick up food and things that they need to take care of their families. We do health and wellness screenings, blood pressure checks, cholesterol checks, BMI, those types of things, just to keep awareness and consciousness to the community about health initiatives and nutrition classes, do vital signs classes, and eventually we'll do some resume writing classes, interview skills, and check us out. You can go on our website at mdwhitehedmedicalinstitute.org.
Welcome back to the Dr. Wayne Show, and we are having a discussion today with Tyrone Walker, and he's been generous enough to come by today to talk with us about his experience with COVID-19. He's one of those successful persons who had some experiences with it, him and his family, and was successful. So he's been generous enough to come by and talk with us to share his experience with us, you and our viewing audience. So Tyrone, so thank you thank you so much for coming by and being with us. You shared with us your hospitalization experience. You stated that you had a rather fast recovery.
Yes, sir.
What about lingering type of effects of COVID-19? Have you experienced anything, or some people talk about lingering effects of shortness of breath or things of that nature. Have you experienced anything, or have you, to your knowledge, had a full recovery?
To my knowledge, I have had a full recovery. One thing that I haven't dealt with since I was 10 was, I've been through a lot the last 10 years of my life. One thing that I didn't have to deal with was my sinuses. For some reason now, and I can't say COVID, it's COVID-19 that happened, but I haven't had sinus trouble since I was 10 years old. But now my sinuses just drain real bad now for some reason. But once again, I can't prove it's
related to
yes,
that.
sir.
But you just noticed that that's something that
yes, sir.
that you're seeing more of,
yes, sir.
Which is out of the norm for you.
Yes, sir. Way out of the norm. Yes, sir.
Okay. When this is we're at the end of July now. When did this take place for you?
It was mid-March.
Mid-March. So
yes,
you
sir.
were kind of in the early stages of this when it really got up and going here in the United States. So you were kind of among that first group.
Yes, sir.
Where, and you got through this first and foremost.
Yes, sir.
That was kind of a tough time too.
Yes, sir.
Because a lot of the treatments, they're getting better with the treatments now, but you were at the stage when they didn't know a whole lot
yes, sir.
about treatments. So you're one of the first ones, and you're a faith person too. See, God,
yes, sir.
I'm going to say there was some intervention there too.
Yes,
God
sir.
is good God.
Yeah, amen. Amen. Amen.
Yeah, you can't do that. So he
Yes,
blessed
sir.
you. How has that impacted those around you? And if you do it, do you do anything different? What are you doing different now? Are you doing anything to make sure that you prevent contracting or transmitting
yes,
or being
sir.
around people? What do you do different now?
The thing that I do different now, I make sure, me and my wife, when we go places, we keep our Lysol wipe with us. We make sure we wear our masks. We make sure we distant. We haven't been nowhere. We make sure, we wash our hand properly, and doing everything that the CDC guidelines say do. But one thing I won't do is I'm gonna do what the CDC say, but I'm not gonna live in fear, because I feel a lot of Americans are living in fear right now, and they're being tormented because they're living in fear. Just because of it can go left. I understand that, and it can get worse. I totally understand that too, but I believe in a God that if you serve Him, He gonna protect you. Yes, sir.
And I agree with that. And at the same time, you're doing the things that
Yes,
you know,
sir.
we are supposed to do here.
Yes,
you know,
sir.
Is follow the guide of those who God has put here for
Yes,
us.
sir.
Like you said, you just talked about the CDC, and you know what you say. You know what you're not being disobedient.
No, sir.
And God
No,
don't
sir.
want us to be disobedient to
Yes,
those
sir.
that He's given to us.
Yes,
you know,
sir.
like the doctors and the healthcare providers.
Yes, sir.
Told you this is your guidance, and you're being obedient to that.
Yes,
so
sir.
He's doing that thing for you.
Yes, sir.
You know, he's
Yes, sir.
protecting you. Your family now, has it affected anyone outside of your family or your immediate family?
Yes, sir. It have. I know that Tuesday, I think I can say it. I went around my pastor, and he contracted it. I don't know that Tuesday when he was around me before that Thursday. I went in the hospital. Then he contracted from me, but he contracted it. But they did real good on it too.
He
Yes, sir.
got through it successfully.
Yes, sir. Him
God,
and his wife. Yes, sir.
that's very good. That's
Yes,
very
sir.
good. Again, it points to the importance of us. We really have to be cognizant of the guidelines.
Yes, sir.
Right now, just in this season.
Yes, sir.
We're in a season now.
Yes, sir.
You know, where we have to be. We don't know, and you know, we just have to be precautious.
Yes,
you know,
sir.
And they say that the mask now, they're recommending the mask and the social distances. We have to be in compliance to that.
Yes,
Because
sir.
you know, you never know. You
Yes,
could be
sir.
around somebody and just innocently talking. It's
Yes,
something
sir.
you can't see. Since it's something you can't see, we have to just be precautious. So we're glad that those people have gotten through this successfully.
Yes,
and they're
sir.
doing well.
Yes, sir.
What would you share with people, any kind of advice that you would share through, let's say somebody's going through this. You
Yes,
know, I
sir.
know that was a frightening experience when they shared that with you. How long, let me ask you this,
Mm-hmm.
how long when they went from the time you were tested to the time they were able to tell you that you were positive? Whether you were in the hospital when they did that, right?
Yes, sir.
And they were able to give you the results. How fast was that?
They tested me that Thursday about 2:30. That Sunday, the nurse came in. I guess she was the charge nurse, and she told me that
Okay.
I had COVID-19. It was then, you know, and you know, and I won't sit down and tell no lie. It was frustrating because of everything I had to fight and endure these last 10 years.
Okay.
Yes, sir.
Okay.
But I kept the faith, you know. I repositioned myself and, you know, realized that I was a fighter. And I was going to fight this situation regardless of how it went, I was going to fight it to the end.
Okay.
Yes, sir.
So, but if you said frustrating, was it frightening?
Yes,
To
sir.
hear that?
It was.
frightening.
It was.
Okay.
Yes, sir.
To hear that, because we hear all the bad news around COVID-19. So
Yes,
it was
sir.
a frightening, frustrating, but also frightening.
Yes, sir. Frightening.
And fearful that you could potentially lose your life.
Yes, sir.
And but
Exactly.
you had to recenter yourself.
Yes, sir.
And understand, and you had to understand and go back to whose child you are.
Amen. Yes, sir.
And you got yourself together.
Yes, sir.
Okay.
Yes, sir.
And start coming through this thing, and look at where you are.
Yeah, man.
You
Amen.
understand?
Yes, sir.
And all that you endured.
Yes, sir.
And you look at what wasn't supposed to happen according to the statistics.
Yes, sir.
Diabetic.
Yes, sir.
You understand?
Mhm.
A diabetic, high blood pressure.
Amen.
You understand?
Yes, sir.
Yet, 4 or 5 days hospitalized up and out of the hospital.
Yes,
when
sir.
people have been in the hospital for weeks and months on ventilators.
Yes, sir.
You understand? Some got better,
Yes, sir.
and some are no longer with it.
Amen.
You understand? With some are lesser,
Yes, sir.
underlying health condition.
Mm-hmm.
You know, but you had you were a diabetic, and you were there 4 days.
Yes, sir.
Yes, sir. 4 days. I'm right.
Well, Thursday, Friday, Saturday, Sunday, and then let me out that 5 days.
5 days.
Yes, sir.
5 days out of the hospital, but never on a ventilator.
No, sir.
You understand, and you're up and you're doing well.
Yes, sir.
Doing better than some folks that didn't have any
Yes, sir.
underlying condition. So thank God for it.
Yes, sir.
You know, you're a testament to miracles and what God continues to do.
Yes, sir. I appreciate that, Doc. I appreciate that. And like I said, you know, me and my wife, we talk, you know, pretty much every day. After like the 7th day, like I said, you know, she still was going through real bad. And I felt so sorry because I couldn't do nothing more to help her than what I was doing. And, you know, sometimes, I was praying to God, you know, I wish it would have been just me, you know, beside my family. And we talked. And she used to be like, you know, how, you know, you just up and just, you know, just moving around, doing everything. And, you know, it's just hard for me to even get up and even walk to the bathroom, you know. I couldn't, explain, but I just kept praying about the situation. But now, like I said, you know, she came out of it. It took a while, but, you know, she came out of it. And, you know, I'm just so grateful to God that, you know, he brought her all the way out. She on some medicine now, and I'm praying, you know, now that, you know, even he would even take that away from her. Okay. Yes, sir.
Okay. You shared with us earlier, not in the discussion, but you said that was something else that was discovered that was going on with her.
Yes, sir.
In this process. Do you care to share with us, or you don't have to?
Oh, yes, sir. You know, she didn't never have nothing wrong with her. You know, her blood pressure was always good. Everything was always A1 with her. And when after this happened, that's when some of these, you know, like now the blood pressure medicine, you know, she's on it. Where it took me 7 days to get up to, you know, 94, 95% oxygen level. It took her almost 4 to 5 weeks to get up there. Yes, sir. And wasn't nothing wrong with her. I guess one of those things, it just affect people differently.
It affects it,
Yes,
yeah, it does. And that's what we're finding out, is that this COVID-19 thing, this virus is affecting people in a whole variety of ways according to individuals.
Yes, sir.
You know, some people have no symptoms. Quite a few people have no signs and symptoms.
Yes, sir.
And then others, it affects to the point of almost death.
Yes, sir.
People are, you know, it's damaged their lungs, their heart.
Yes, sir.
People have had strokes.
Yes, sir.
So a whole variety of things. Folks, we've had a very good discussion today with Tyrone. He's come by and to talk with us about his personal experience with COVID-19, and to let us know also that this thing is real.
Yes,
and
sir.
we have to take it very seriously. We've got to follow the guidelines of the CDC and the experts and the information that they're giving us about masking up, the social distancing, continue washing and sanitizing our hands on a regular basis, restricting ourselves from large gatherings. We have to continue to comply with those things, because we want to make sure that we're all here for our family, our friends, those loved ones that need us and want us around for a long time. Amen. So let us keep that in mind and continue to follow those guidelines. We've had a good discussion today, and we want to again thank Tyrone for coming by
Yes, sir.
and spending some time out of his schedule. He can't take it upon himself to come by and just say, because he wanted you, the public, to know that he got through it, and we're going to get through this.
Amen.
I'm Dr. Wayne, and thank you for joining us today on the Dr. Wayne's Health and Wellness Show. Until next time, have a great day.